In these times of the immunotherapy revolution, what I did is I went over the main mechanisms of actions of the new immunotherapies that are being developed in multiple myeloma, starting with antibody-dependent cellular cytotoxicity that underlies the efficacy of new drugs such as Dacetuzumab or Elotuzumab. So I tried to explain which are the main features that favor these kind of effects from the point of view of enhancing the number of effector cells, of NK cells being able to kill the targets. I also summarized about the receptors involved in these interactions and the ways they can be manipulated to exploit them in terms of enhancing cytotoxicity. Aside of that, I presented data, what is probably being the most important revolution in cancer therapy for decades, which is the implementation of immunomodulation. And I explained the mechanism of action and the experience in solid tumors with checkpoint inhibitors, with antibodies that tampering with inhibitor interactions for T-cells are able to result in a stronger immune response that in many instances prolongs survival very significantly, and has actually led to the approval by the FDA and regulatory agencies of 9 indications using antibodies directed to the receptor ligand pair PD-1, PD-L1 that was actually covered. And I explained that the earliest data in myeloma using anti-PD-1 antibodies in combination with thalidomide analogues, lenalidomide and pomalidomide, are showing signals of being effective and having great potential and holding hope. Also, I reviewed data on the use of adoptive T-cell transfer using CAR-transduced T-cells, what has been learned in the field of acute leukemia, or B-cell lymphoid acute leukemia, and how these data are trying to be translated to myeloma using a variety of CARs. We are at the infancy of that field in multiple myeloma, but most likely will be also establishing itself as a modality of treatment in this disease.